Hi, my name is Katie, and today I will be showing you how to assess your patient focusing on the cardiovascular system. For this patient assessment, you will need a pen, adult standard observations chart, stethoscope, sphygmometer, and a thermometer. Hello, my name is Katie, and I will be your nurse for today. Can you tell me what your name and date of birth is? Great, thanks Daniel. And are you able to tell me what you are here for? Okay, good. Well, today I will be performing the examination for your cardiovascular checkup. This examination will require me to touch you for certain steps when taking your observations. Is that okay? Great. Before I begin, I am just going to draw the curtains to give you some privacy. I need to ask you some questions about any previous and/or present issues with your health. Is that okay? Do you know of any family history or cardiac failure and/or diseases? Have you been experiencing any unusual headaches or any loss of movement or sensation? Has there been any tremors, spasms, memory loss, or any loss of consciousness? And have you been experiencing any changes to your normal health? Any problems with swallowing or breathing? Has there been added stresses to your life lately? What would you say your support system is like? And how are you feeling in general? Okay, good. Before I begin the assessment, do you have any questions for me? The first step was interview, which we have covered. Secondly will be inspection. Thirdly, palpitation. And fourthly, auscultation. Firstly, I'm going to perform the neurological examination, and that just means I'm going to see how your sensory neuron and motor responses are working. I'm just going to shine a light into your eyes and just look straight past my shoulder. Now if you could follow the light with your eyes. That's great. Now I am going to put both my hands in front of you, and I want you to grab hold with both of your hands, and on the count of 3, squeeze. 1, 2, 3. Good. I'm just going to feel for any unusual bumps or lesions on your neck. Please swallow for me. And now I will examine your glands to see if there is any sign of infection. I'm just going to pull down on your lower eyelids to check for any signs of anemia. Anemia is one of the signs that the heart is not functioning properly. And can I just check your temperature now? Great. Have you been experiencing any pain, earaches, or vertigo? I am just examining the corners of your mouth to check for any signs of cracking, which is another sign of iron deficiency and anemia, or a lack of vitamin B. Could you please open your mouth so that I can inspect your general oral hygiene and look for signs of dehydration? Say ah. Now that the first 2 steps have been ticked off, we can now move on to palpation, and then lastly, auscultation. When examining your patient, the skin is a vital key role in understanding how the patient's cardiovascular system is working. I'm going to inspect your skin for any redness, rashes or bruising, discoloration, and the temperature. Pale skin and cold hands is a sign of failure in your cardiovascular system. Looking at your nails, I can't see any signs of clubbing, which rules out one of the symptoms of respiratory disease. I now need to assess your lower limbs. Can you please lie down on the bed for me? First, I am examining your ankles for any signs of edema. Have you been experiencing any pain or swelling in your joints? Okay, good. We can now check off the interview, inspection, palpation, which leaves us with auscultation. I now need to listen to your heart, lungs, and other organs, which requires me to place a stethoscope on different parts of your chest. Is that okay? Firstly, I am listening for any abnormalities in your lungs and heart. Any heart murmurs will indicate that a valve is not closing properly and the blood is leaking backward, regurgitation. Can you now breathe in and out nice and slow? And one more time? Good. You can now sit up for me. Thank you for watching.
created using Powtoon.